Okay, we have next up Liz Helms. Liz is the president and CEO of the California Chronic Care Coalition. Liz has been a leader with patients' rights movement since her recovery from TMJ in the 1990s. And as somebody who runs across her in Sacramento and talks to a lot of folks that she interacts with, she's very well respected, has a ton of energy, and just knows, I think, everybody in the Sacramento political and regulatory arena. So with no further ado, Liz Helms.
Good afternoon. This has been such an inspiring day for me, so I hope I can inspire you as much as the other speakers today have. It's been just phenomenal. I want to thank Dominic for inviting me to come here and speak. Working with him, like you said, 2 o'clock in the morning, I mean, he's like, can you go to bed? Yeah, can you go to bed? Things that we're supposed to be doing, because we are advocates, we're also supposed to get rest, because generally, advocates have had a reason for becoming an advocate, and it's generally because something personal has happened to them or a family member. So rest is very important. I want to just go over, I know we don't have a lot of time. Let's see. Oh, no, I think we were okay. There we go. Okay, so I'm going to run through these slides. I have a lot of slides, and I know we're running short on time, so I'm going to give the slides. Dominic already has the slides, has my permission to share them, and if there's more, if the people request to do more with the advocacy work that we're doing and learn more, or you want more advocacy training, we can always do a webinar later on. So I just want to let you know, and I'll be here to answer questions. But I just want to give you a little overview of what I'm going to go through today, because I want you to come away today with an understanding of effective grassroots advocacy at the political level, at the local level, the county level. There's so many different levels of advocacy, and somewhere it might fit best for you. We are a state organization, so we advocate not just at the state level, but our groups are spread out through the whole state, so they advocate in all different areas. And then in the last year, we really got involved in some of the federal issues, which I'll go going through that. I'll talk to you about joining and working in a coalition and how the National Neuropathy Action Foundation works with us, and why it is, I mean, you've heard this so much today, why is it so important to tell your story? It really matters. Every single voice matters, and I'll get more into that, and then we're going to give you a roadmap to achieving some of the goals and objectives. So I want to just quickly tell you how I got started in advocacy, because I had no idea I was going to be one. I didn't even know what the word advocate meant. I had a doctor say, "Are you an advocate?" And I said, "Yeah, sure," but I didn't know what that meant. And it was only because of a personal injury that I had and all the denials of care that came after it. So here this is actually me when I was a baby. And I was happy and didn't know things were going to be a problem. And until the early 1970s, I had problems with my jaw, but it wasn't until the 1970s when I had my wisdom teeth pulled that everything kind of broke loose, and I had my first surgery, whole different healthcare system at that time. Got surgery, lasted 20 years, it was great. 20 years later, I go and had an adjustment, and it went awry, and it tore my joint apart. And it healed, and it fused together, so it ankylosed, no movement on the right side, and the left side started to get beaten up, and I had 2 health plans that said not medically necessary, and denied, and denied, and denied, and denied. And that was in the early stage of managed care, when managed care and HMOs were just starting to really get going in California. So I learned the hard way. So lucky for me, I had a lot of friends that watched what was going on and that actually worked in politics. And so I was feeling sorry for myself, and I said, they treat animals, better than they treat humans. And finally someone just yelled at me and said, so what are you going to do about it? Are you going to take it lying down, or are you going to get up and do something and quit feeling sorry for yourself? So I had an amazing doctor who actually went ahead and did the surgery, had surgery. I was off for 6 months, but it was over a year between the time the injury happened and the time I actually went in for surgery. So I was pretty sick during those days. 6 weeks after my surgery, I was up and running and I haven't stopped running since, and that was 1994. So getting the right care at the right time is really important. And this year is a big year because for the last 9 years I've been working on a book to get next generation advocates, and it was just published and launched in April of this year. So I'm really excited about that, and I hope that all of you get a chance to get it and read it, and I have some here I'm going to leave with Dominic that I'm happy to hand out. So anyway, I just wanted to go through that because you never know the road. You never know where it is that you're going to go. You never know what's going to bring you to the forefront of something that's going to be really important to you and have a lot of value. And just like Grant was saying, I mean, so amazing. He had a whole different life path. And I had a whole different life path. I was going to school working on my agriculture degree. I had no idea I was going to end up as a healthcare advocate running a statewide organization. No idea. So it's embracing that and going with it and dealing with the challenges that you face. So I want to tell you a little bit about our organization. We came together in 2006 at the request of the Schwarzenegger administration. It was the year as healthcare reform was just getting started. There was no ACA, there was no Obamacare, there was California. California cared. We had a governor that actually cared about doing something about the healthcare system. So he brought everybody together, but the voice of the patient was missing at the table. So I was asked, I'd been, pretty big activist for 10 years or so, and had really great relationships, because you always want to have great relationships. You don't want to burn bridges even if you disagree, horribly disagree. You don't want to burn those bridges because you don't know when those bridges need to be built again and when you're going to need those people. So we started with 19 groups. We now have over 30 organizations. And if you look at them, they're real diverse. I mean, they're not just nonprofit health advocacy organizations. They are provider groups. They are consumer groups. And this year we did something really different, and I just want to call your attention to it because I'm pretty excited about it. We stepped out of our comfort zone. We do that a lot, but we always stay on our mission. And we had the California Life Sciences join as a general member. And we did that because this next year is going to be a really big year for us. As we move forward, we want to change the conversation completely. We're so tired of the fights at the state capitol and across the country on health care and a system that's broken, and people don't want to talk about all the parts of the system that are broken. They just want to point fingers and blame. We want to change that conversation. We want to move to, let's talk about infrastructure, let's talk about research and innovation, let's talk about value, let's talk about other things that are going to get us where we need to go. So we needed the Life Sciences organization at the table with us as a member, so they're really engaged and involved in the conversation. And as we look at it, we know that we're spending 84 cents of every healthcare dollar on chronic conditions. A lot of that is preventable, a lot of it isn't. And so we want to spend the money the most wisely and work on preventative measures where we can. The mission of our coalition, like I said, we have over 30 leading consumer health organizations, physician and provider groups, and a shout out to Teresa here from the Physician Assistants, who's a member of our group and very active member, so thank you. And we envision a system that doesn't just talk about access and quality. We talks about team-based care. We talk about innovative ways using the pharmacist, like we're using comprehensive medication management. How do we get the patient-centered medical home, and how do we keep the person in the center of the conversation? Sometimes we don't forget, we have to keep reminding everybody that there actually is a real person in the middle of all of this that has feelings and needs help and needs the right diagnosis and needs the right treatment at the right time. And sometimes when you get into the business aspect with the health plans, they sometimes forget that, so we're always there to remind them. They love us, but we do work with them. And then I just want to show you a couple of our programs, and I know The big one that Dominic was talking about earlier today was our National Stakeholder Specialty Medication Initiative. And I'm just going to briefly run through that because I think that's so important and it really affects all of you. When I was working on a project in San Diego, we were working on an innovation grant. And so I'm sitting on all these webinars, since you never know when something's going to hit you in the face. And they're talking about medical benefits and pharmacy benefits. And they're talking about how they wanted to move many things out of the medical benefit world and into the pharmacy benefit world. To me, that said dollar signs for patients, that they were going to shift costs onto patients. And so I started asking questions. Hey, what do you guys know? What are you hearing? What do you see? Is anybody having problems yet? And a lot of the infusion therapies are come out of the medical budget side. We didn't want to see those end up over in the pharmacy benefit side. Same time, Covered California starting, right? 2014, their first year out the door, ready to go. People are hitting the pharmacy $6,200 first month out. We said, that is unacceptable. How can you have a system, and how could you tout a system that says that they're going to be affordable? I mean, that's everything that they had said through the ACA, that it was going to be affordable, we were going to have better access, all these things. So I started talking to our group, and I asked them what they thought about taking the issue on of specialty meds, because we saw co-pays become co-insurance, and we saw high co-insurance costs to consumers. We said, we have to do something. So a lot of people said to me personally, you shouldn't do that. Let Covered California come out the door and let them get started and give them time to get moving. And I said, at whose cost? At the cost to the patient? We can't allow that. So we organized, the national organizations really rallied around it, gave permission to their state organizations to really rally around it. They said, we've got your back. And from that point on, we moved hard and heavy. And we looked at previous laws. We found under Unruh, which is in the regulations, state regulations, back in the 70s, under civil rights, that they actually put the verbiage in there about medical conditions. And we said, aha, that was our aha moment. We're going to look at that. And we had a legal opinion done on that. And they said, yeah, you're right. Because my thinking at that time was, remember pre-existing conditions that were supposed to go away, and you were supposed to be able to get insurance, and everybody was going to have coverage? What did that really mean? If you had a pre-existing condition and now you have a chronic disease that's gone into a higher cost and a higher tier, what does that really mean to you? It means that you've been carved out and a payment system has been set up to treat people with chronic conditions, and we said, that isn't right, that's discrimination, and we want to challenge it. And so everybody said, no, that hasn't been challenged in the past. We said, well, it's time to challenge it. We went to work at it, and everybody was at that point freaking out. I mean, the health plans were freaking out. Not us. We were ready to move on it, and we did. And we got Covered California to join us. They pulled stakeholders together in less than 1 year. In less than 1 year, without legislation, the health plans came forward and said, we're going to change our copays, and they capped all their copays. Fourth tier at $250. Pretty amazing. And then a bill came through last year, which was 339, that put it into statute. So there's still work that needs to be done on it. We need to hear back from people, but that was a huge victory. Covered California, the Department of Insurance, the Chronic Care Coalition, we all had press releases going out. At the same time, we were all shaking hands with each other. They weren't mad at us. They were happy because they showed that you can work with government entities and your voice does matter. And you just can't back off of it, ever. When you have a mission and you have an issue that is so important to you, people's lives really matter, and they matter to us, and we weren't going to let them have it. So we won that issue. So here's a little bit about the Civil Rights Act, and then at the same time we found in the ACA in Section 1557 another clause that talked about discrimination. So that went viral, and we started working with the national organizations, and they actually did file a legal statement and went to CMS and asked for a rule change and a definition, and so that's been ongoing. We're getting ready to do a webinar, a national webinar coming up pretty soon with the results of what what the findings were with that, with what CMS came back with. So we'll get the information out to you so you can be on that. So here's how we united. We wrote letters. We were in these meetings on Friday afternoons. They would say, okay, by Monday morning, we need X amount of information back. That meant we all worked on the weekend. We had it back to them on Monday morning, and we just never stopped on that issue. So where do we go from there? So now we're working with other states. We're trying to move this across the country. Some of the other states have already had legislation done. Some have had, like we did, we had rulings made without legislation. We're looking at continuity of care and step therapy and prior author, all these barriers that are so ridiculous because we've been working on this for way too long, and they don't save money. They don't save money when they do that. So here's a perfect example. Now we work on a big heart attack and stroke project with the Department of Health Care and all the different UC systems. And in many cases, heart attacks and strokes are preventable. Sometimes they're not. But what really called my attention and really sparked my interest was when I was working in San Diego, we were working in Southeast San Diego, huge disparities in there. And we found out, working with the faith-based organizations, that the African American community had a 70% higher rate of heart attacks than anybody else in all of the county. And I said, well, why is that? So then we were talking about, if you prevent it, look at the people that we lost here that didn't need, they were young men. You know, these were all celebrities. So when something happens to a celebrity, it actually gets your attention, but it shouldn't have to be that way. So we've been working really hard at implementing prevention methods. San Diego got a CMMI grant. Heart attacks have moved from number 1 to number 2. That's a huge change, huge change. And now we're spreading it throughout the state with Healthy Hearts California by the Department of Public Health. And then with the Department of Managed Health Care, they bring the clinical side together. So that has launched in Los Angeles, Sacramento, and San Diego. So lots of work being done. I mean, it's nonstop work, but the value of what we're going to come out at the end of it is really going to be important. So back to the specialty meds, we all united. We had a call to action. Any good advocacy, doesn't matter how angry you are, you can't let that anger take over you. You have to think about how you want to implement strategies that are going to get you to your goal. So we had calls all the time. We had our group, we had meetings, we held a stakeholder collaboratory. At that, the health plans boycotted us. They all had the same excuse for not coming, but they were all invited to come. And we had the media there, and Covered California came, and Covered California was mad at me because they thought I set them up, and I said no, and they said, well, why aren't the health plans here? I said they were all invited, so he got on the phone, started calling, and then it came down to, we all met with, we actually had a conversation with the plans and said, you know, they felt we were just going to sue them. And I said, well, you know, we're advocates. We don't just end up in courtrooms. We like to fix things. And so I went to their conference on high cost of specialty meds. So I kind of went into the den. Everybody said, oh, no, you shouldn't go. You shouldn't go. I said, I'm going to go. What could happen to me? I mean, what could happen to me that's any worse than it's happening now? It was great to go. We actually got our prior authorization bill through because the biggest opposition was in that room. We had conversations about that there. And so they pulled off a little bit and was able to go through. So that was a big win. The health plan said, we will never boycott another one of your meetings. So that was another piece. So that was really good at building some of those bridges. And we can still fight with them, but at the end of the day, we can still talk to them. Can never stop talking. So as we built this coalition, you know, and we talk about the power of grassroots and how important a collective voice is. So, you know, the Neuropathy Action Foundation has its mission and works with all of you on very important action items and healthcare issues that are important to your group. But as a whole, there's another voice when everybody comes together. So we all have an opportunity to have a collective voice. And now our voice at the Capitol, because we've been so successful with the work we've done, is they want to know what we think. They actually want, I mean, I get called in. I've been called in last couple of weeks. So one of the senators was mad at me. It's okay. I sat down with him later. He's probably still mad at me. His bill didn't get out. One of our bills didn't get out. So, you know, things happen. Sometimes you don't always win the issue that you want to win, but that doesn't mean you give up on it. You can come back and rebuild it again. So what does this all mean when you build this coalition? So you have a collective voice, you have a diverse group of stakeholders, you can collaborate. And we have no problem disagreeing because we have such a diverse group. But it's because of that kind of conversation that we have that we're able to come to consensus and move things forward. It increases our visibility. It increases the visibility of an organization that wouldn't have that kind of visibility unless they really had a strong voice and a lot of people were together. And then it promotes community health in a bigger way, and then we become a trusted resource. So what's success to us in being effective? What would be successful to you? Everybody has a different definition of what success is. But in organizing, in identifying your goals, in identifying your objectives and working towards them, it's not simple. None of this is simple. It takes a lot of work and a lot of people with a lot of passion. And then we always have a positive media message. Even if the media is trying to take us in another way, we always have a positive media message, and you have to have control of that message. You have to understand your issue enough that if you talk to the media, you have control of that message. And then whatever we do, it has some way of impacting policy. At some level somewhere, we work with all the agencies in California as well as the legislature. So we're not just in the legislature doing public policy work and working on legislation. We're actually working it from the ground up in other areas. And then who we partner with. I mean, we have partnered with the pharmaceutical companies. We have done things with the health plans. We have done things with the regulators. We have done things with a host of different organizations. And we love working with the community-based organizations and faith-based groups, and then all the different health organizations. So I want to just spend a second here telling your story, because I think for you guys this is really, really important, because your voice matters so much. And because many times people don't think their voice matters, and they'll say, what does it mean for me to come forward and say anything? That's what I said. I was so wrong. Your voice really, really matters. And when we do public policy, when we go before the legislature, sometimes we're doing a briefing. We need your story. Your story means everything. They don't want to hear, I'm a talking head now. You know, I'm just part of the establishment. And even though my story will never be taken from me, they don't want to hear that anymore. They know we're effective in what we do. They want to know what are the trends, what's really, truly happening out in the community. And so develop your message and obtain the facts. You have to have your facts and what's the goal, and then anticipate any questions, and then keep your focus. So that's, you know, what we do when we help people get ready to come and testify, or meet with other agencies on the issues that we have at hand. And then here's how our collaborative roadmap to success is that we want to be a trusted resource. Like I said, we work with all the different agencies, and you know what? It's okay to leave your comfort zone. It's okay to be uncomfortable, because that's the only way we're going to change the status quo. If we keep the status quo where it is, nothing will change and nothing will get better. So here's some of the milestones that we had that were successful in the last few years with the out-of-pocket caps on specialty. We got AB 339, which was the continuation of the specialty issue. AB 374, which was a step therapy issue. I Am Still Essential launched on the East Coast that worked with CMS, but it's I Am Still Essential, so someone with a chronic disease shouldn't be just marked out and off, that people's voices are still really matter. And we've done ad campaigns, we've built media relationships, we are on advisory committees and boards all over the country. I'm on two boards. One I just got elected to, which is the Alliance for Integrated Med Management, which is national, and then the CHIPI board, which is the California Healthcare Performance Information System, actually working with the health plans on their big data. And I know that I'm going to just tell you about this, and then I'm going to run through the rest real quick. This year has been ugly, really ugly at the Capitol. And we had 3 bills that we really thought were going to get through that our groups are working on. Our bill was on continuity of care, fixing the continuity of care. It was a very simple bill. It fell. AB 2400 was by the Arthritis Foundation. It fell. It was on something in there about prior authorization and streamlining it. And AB 2084 was in regards to comprehensive med management that had zero opposition, zero. No one was against it. Still went down, got pulled in suspense. And then we have ballot initiatives, and we have drug pricing issues, and we have all these different issues that we're working on. So it's really ugly, but we're still working through it, and we're going to beat all these challenges and move it forward. And here's some of the reasons why. We knew back in the 80s when we realized HIV and AIDS had taken a huge toll on people's lives. I lost 6 friends in the late 80s, early 90s. Everybody said it was going to break the bank. And now we look at HIV as a chronic condition. And the people that I know that are HIV positive live a normal life. So we have lots of work to do here. We have ways we can get through. We can talk about total cost of care, and looking at utilization when you look at the whole person, because they usually have more than one chronic condition. Look at all of it and bring it all together. You're going to save a lot of money. We've been doing work in that world. And then looking at getting at the decision table, being a stakeholder at the decision table. We're not afraid to sit down with people, and we're not afraid to speak up and speak out. So we have a really good voice in anywhere that we go. And we always love new people to come in, so we welcome you to come and say, hey, we want to work with you. You can tell Dominic and all the different groups that you're all associated with, yeah, I want to get involved, I want to get involved. And then you can get involved actually on August 2nd. We're having our first advocacy day at the Capitol, and we're having a big briefing. And so let us know if you're interested, and we'll send out, the invites are almost ready to go out. They'll be out by tomorrow. And then just recapping, and moving forward, find a problem, that's everyone that has a common thread. If it's too big for one group, it may not be for a collaborative. It may be small enough to log on an early success, so don't worry if you don't get something big done, but you get something little done, and then build on it and remember where you started. And is it hard? Oh, yeah. It's hard. It's hard, but you know what? We moved that mountain. We moved that boulder up the mountain. We rolled it. There was not just one person there, it was a whole team. But anyway, I so appreciate being able to come here today and share some of our experiences. And the last thing I just want to say is, in the introduction to my book, the reason that I wrote this book, and I just want to read you something really quick. It says, my hope in writing this book is that my story will encourage you to go further when the road seems impossible to travel, stand taller when you feel beaten down, and to seek those who share your passion for change. So thank you very much for having me here today.